questions focused on the enzymatic inactivation resistance mechanism, particularly beta-lactamase penicillinase activity that cleaves the beta-lactam ring of antibiotics like penicillins, cephalosporins, and carbapenems. Question 1. Enzymatic cleavage of penicillin. A 70-year-old hospitalized man is being treated for pneumonia with intravenous penicillin G. Despite appropriate dosing, he remains febrile with persistent leukocytosis. A sputum culture grows Staphylococcus aureus. Which of the following best explains the bacterial resistance to the administered antibiotic? A. Altered penicillin binding proteins. B. Efflux pumps. C. Beta-lactamase production. D. Ribosomal mutation. E. Cell wall thickening. Correct answer C. Beta-lactamase production. Explanation: Staphylococcus aureus often produces penicillinase, a type of beta-lactamase that enzymatically inactivates penicillin by cleaving the beta-lactam ring. A. Altered PBPs are seen in MRSA resistant to methicillin oxacillin. B. Efflux pumps are common in tetracycline macrolide resistance. D. Ribosomal mutations are involved in macrolide and aminoglycoside resistance. E. Cell wall thickening can contribute to vancomycin resistance in Staphylococcus. Question 2. Carbapenem resistance mechanism. A 55-year-old man develops sepsis due to a multidrug-resistant gram-negative rod. He is started on meropenem but shows no clinical improvement. The pathogen is found to produce a carbapenemase enzyme. Which of the following best describes the mechanism of resistance? A. Methylation of 23S rRNA. B. Altered DNA gyrase. C. Enzymatic hydrolysis of antibiotic. D. Porin channel upregulation. E. Phosphorylation of the drug. C. Enzymatic hydrolysis of antibiotic. Explanation: Carbapenemases, a type of beta-lactamase, enzymatically inactivate carbapenems through hydrolysis of the beta-lactam ring. A. Methylation of 23S rRNA is associated with macrolide resistance. B. DNA gyrase alteration causes fluoroquinolone resistance. D. Porin loss, not upregulation, may contribute to resistance, but is not the primary mechanism here. E. Phosphorylation is a resistance mechanism for aminoglycosides. Question 3. Failure of beta-lactam therapy. A 60-year-old woman is being treated for a urinary tract infection caused by Escherichia coli. She was initially started on ampicillin, but urine cultures reveal resistance. Which of the following mechanisms is the most likely cause of her antibiotic failure? A. DNA mutation in peptidoglycan synthesis enzymes. B. Enzymatic cleavage of the beta-lactam ring. C. Alteration of the 30S ribosomal subunit. D. Mismatch in codon-anticodon pairing. E. Decreased bacterial membrane permeability to urea. Correct answer: B. Enzymatic cleavage of the beta-lactam ring. Explanation: E. coli commonly produces beta-lactamases that inactivate drugs like ampicillin. A. Mutations in peptidoglycan enzymes are not a common resistance mechanism. C. 30S ribosome alteration affects aminoglycosides, tetracyclines. D. Mismatch in codon-anticodon is not a drug resistance mechanism. E. Urea permeability changes are unrelated to beta-lactam resistance.